everyone! My name is Lauren.
My name is Gloria.
And we're here to answer those questions you've always had. So have you ever been at the dentist's office and had that question for the dental hygienist you've been too embarrassed to ask? Well,
we created and invited you to participate in an Instagram survey.
And we got a lot of questions from you guys, so we chose the top 10 questions that we decided to answer for you today. Great pointing.
Question number 1, does flossing really make a difference?
So yes, dental floss is the #1 recommended product for cleaning the areas between your teeth. Benefit of daily interdental cleaning, such as flossing, is the reduction or prevention of inflammation, which can be caused by the toxins produced by plaque biofilm. So flossing, in addition to toothbrushing, reduces gingivitis in comparison with toothbrushing alone. So yes, flossing daily is very important.
Great question. Question number 2. What are the healthiest ways to whiten your teeth without destroying the enamel?
So according to the American Dental Association, there are actually 4 ways to put the shine back into your smile. So seam removal toothpaste that you can purchase over the counter is one option. Also in-office bleaching such as Zoom. Also at-home bleaching from your dental office. Also over-the-counter bleaching products such as Crest whitening strips. So the very first and most important step is to talk to your dentist to make sure you're the right candidate for whitening. Whiteners may not correct all types of discoloration, such as those caused by medications or tooth injuries. Overuse of whiteners can damage tooth enamel or gums, so be sure to follow the directions with any whitening product you use and to talk to your dentist. So question number 3, are you all so sadistic?
Absolutely not. Absolutely not.
So most of the students are very kind, compassionate, and dedicated to helping their patients. So as a clinician, we try our best to make the experience as comfortable as possible for our patients during each cleaning appointment. We want to make sure there's not any kind of pain or discomfort for you, because it does make us feel awfully terrible. However, when a patient has unhealthy gums, they can become very sensitive, which can make the appointment very unpleasant for them. But by improving your oral health, you can help your gums heal and be much less sensitive during your cleaning appointments.
Question number 4, what are you really measuring when poking and calling out numbers?
So we get this question quite often because at every visit you should be hearing these numbers being called out by us. So what it is there's this natural pocket between the tooth and gums that helps support it. So in healthy conditions, we're going to be calling out those numbers between 2 to 3 millimeters for the pocket depth. When disease is present though, unfortunately, those pockets get deeper, so your tooth has less support. So you might hear us calling out numbers like 4, 5, or greater. So when we poke you, we are inserting a tool or instrument called a measuring probe into the pocket around each tooth to measure its depth. These measurements are important for assessing the health of your gums, and we use them over a longer period of time to really assess your overall health. So these numbers, 3, 2, 3, very important, and you're going to hear them hopefully at every visit.
Question number 5, what do you say when people ask, why did you become a dentist?
So, first of all, being a dentist and being a dental hygienist are 2 completely different professional fields. Dentists focus more on restoring damage that has already happened, such as filling your cavities or replacing missing teeth. Dental hygienists focus on the important preventive aspects such as educating patients about their oral health, discussing the importance of proper nutrition and how it relates to your oral health as well. We do take the time to educate our patients about how there is a correlation between their systemic health and their oral health. Also applying fluoride to help strengthen your teeth, decrease sensitivity, and help prevent cavities. And of course, cleaning your teeth and removing plaque and calculus in order to prevent periodontal disease and bone loss, thus helping you keep your teeth for the rest of your life. Also, a flexible schedule is really nice, and not having a ton of debt is the best.
Question 6, how hard was the schooling process?
Oh my god, no one ever said there was going to be blood and it would be this hard. Oh, and I just
really
did.
hard.
It's like so exhausting. All right, so once accepted into the dental hygiene program, it is 2 years for completion. So there are many prerequisites that we have to take prior to those 2 years. The program is very rigorous and requires much discipline. It is a combination of lecture classes and learning a totally new hands-on skill as well. So if you don't have any past dental experience, such as us or a lot of our classmates, then you start off learning a whole new language as a dental hygiene student. This is all language that you're going to take and use clinically with your patients every day. So once you learn it, you learn it well, but it does take a lot of work to learn. Our schedule is usually Monday through Friday. We're at class or in clinic from 8 a.m. to 5 p.m., usually longer. And then our weekends are actually dedicated to studying. So if we have free time, it's study. So as far as schooling goes, it's the hardest thing we've ever done, but it's actually the most rewarding and best experience we could have asked for. Question number 7, do you enjoy watching us tear up while you get into those sensitive spots in our mouths? Although some of you might think we do, we promise we do not. We strive to make appointments as comfortable as possible for the patient. So as dental hygiene students, we actually spent our first semester treating each other in our dental clinic. So we promise we know how a dental hygiene cleaning feels from our patient's perspective. So question number 8, is it normal to bleed when you floss? So gums bleed when there is something present that's irritating them below the gum line. It's most commonly plaque or calculus. This is caused by bacteria, different debris in your mouth. The best way to get rid of this plaque and bacteria is by brushing and flossing your teeth to prevent gum diseases such as gingivitis or periodontitis. So to answer your question, bleeding while flossing is not normal, and it can actually also be caused by patients' flossing technique. So our best advice is that your next dental hygiene cleaning, ask your dental hygienist to show you how to properly floss and brush, and that way it can help reduce the bleeding that you have when flossing at home yourself.
Okay. Question 9. Are some toothpaste better than others, or are they all basically the same?
So we get this question a lot. Each toothpaste has a different benefit depending on its ingredients. There are so many types of toothpaste out there that are designed for each individual's oral health and needs. There are toothpaste that have ingredients that can help prevent dry mouth, sensitivity, bad breath, and caries, just to name a few. So the best toothpaste for you really depends on what your individual oral health needs are.
Question number 10. What is the most rewarding thing about being a dental hygiene student?
So I think we personally love this question because we've had such great experiences so far being in the program. I think one of the most rewarding things is being able to go out in the community, meet new people, and use all the knowledge that we've learned so far in clinic with our patients. So we have the opportunity to teach our patients about oral health and how it connects to their overall health. So being able to take everything we've learned, connecting it to clinic and connecting with patients is the most rewarding thing at the end of the day for us.
We hope you've been able to learn more about oral health and about dental hygiene as a profession from this survey.
And start thinking about what you want to ask your dental hygienist at your next appointment. A blooper reel, Megan, please. Cut. Okay, so Megan, put in a little screen that says stand by. You know, back in the day they used to have the standby thing and dun, 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 the little music thing. It is a combination. I can't do this anymore. I love you, Megan.
Although
decrease sensitivity and help prevent cavities. You can fix that, Megan. I'm not saying it again. Also, applying fluoride to help strengthen your teeth, decrease sensitivity, and help prevent cavities. Meeting and getting to know. I'm Ron Burgundy.